Lung cancer and its genetic mutations. The lung cancer is one of the most common and deadly cancers worldwide. Traditionally, lung cancer has been closely associated with smoking, but recent studies have shown that non-smokers are not immune to the disease. Lung cancer rates have been rising in non-smokers, especially in their 30s and 45s, and the reasons for this rise include genetic mutations, exposure to secondhand smoke, air pollution, and other environmental toxins. These mutations not only influence the onset of the disease, but also determine the effectiveness of treatment options. Targeted therapies have become a more effective alternative to standard chemotherapy, offering hope for better treatment outcomes, especially for patients whose tumors have specific genetic mutations. Lung cancer originates in lung tissue, usually the cells lining the airways. It is roughly divided into two main types: non-small cell lung cancer and small cell lung cancer, which differ in their biology, behavior, and response to treatment. Non-small cell lung cancer accounts for about 85% of all lung cancer cases. It is further divided into three main subtypes: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Adenocarcinoma is the most common subtype, usually located in the outer areas of the lungs, and is usually diagnosed in non-smokers. Squamous cell carcinoma usually develops in the center of the lung and is strongly associated with smoking. Large cell carcinoma is the least common and can occur anywhere in the lung. Small cell lung cancer, while less common, is more aggressive and tends to spread rapidly. It is strongly associated with heavy smoking and usually presents at an advanced stage, making it more difficult to treat. Lung cancer is the leading cause of cancer-related death worldwide, accounting for nearly 18% of all cancer deaths. In 2020, there were an estimated 2.2 million new cases and 1.8 million deaths from lung cancer worldwide. The incidence of lung cancer varies by region, with the highest rates in areas with high tobacco consumption, such as Eastern Europe, East Asia, and North America. While lung cancer primarily affects older adults, with most cases occurring in people aged 65 and older, there is growing concern about the rising incidence of lung cancer in younger populations, particularly those in their 30s and 45s. This trend is partly attributed to the rising prevalence of lung cancer in non-smokers, driven by factors including genetic susceptibility, environmental exposures, and lifestyle changes. Multiple risk factors contribute to the development of lung cancer, with smoking being the most important. However, a significant proportion of lung cancer cases occur in non-smokers, highlighting the importance of other factors, including genetic mutations, environmental exposures, and occupational hazards. Secondhand smoke, also known as passive smoking, is another significant risk factor for lung cancer. People who are exposed to secondhand smoke, such as living with smokers or working in a smoky environment, have a 20 to 30% increased risk of lung cancer compared to those who are not exposed to secondhand smoke. In addition, exposure to environmental pollutants such as radon gas, asbestos, and heavy metals can also increase lung cancer risk. Certain occupations expose workers to carcinogens, which increase the risk of lung cancer. For example, miners, construction workers, and factory workers may be exposed to asbestos, silica, and other harmful substances. Long-term exposure to these toxins can cause mutations in lung cells, which can lead to the development of cancer. The incidence of lung cancer has been increasing in non-smokers, especially in younger populations, over the past few decades. This trend is worrying because it challenges the traditional view that lung cancer is primarily a smoker's disease. Studies have shown that non-smokers who develop lung cancer may have unique genetic characteristics that make them more likely to develop the disease even without traditional risk factors. Having a family history of lung cancer increases the risk of developing the disease, indicating a genetic predisposition. Studies have found that several gene mutations are associated with an increased risk of lung cancer, including mutations in the EGFR, KRAS, and ALK genes. These mutations can be inherited or acquired during a person's lifetime, and they play a crucial role in the development and progression of lung cancer. Air pollution, especially exposure to fine particulate matter, is a significant risk factor for lung cancer in non-smokers. Long-term exposure to polluted air, especially in urban areas, can lead to chronic inflammation and DNA damage in lung cells, which increases the risk of lung cancer. In addition, exposure to environmental toxins such as radon gas and heavy metals can also cause lung cancer in non-smokers. Lung cancer symptoms and diagnosis. The lung cancer often goes undetected in its early stages because symptoms may not be obvious or may be mistaken for other common respiratory illnesses. However, as the disease progresses, symptoms become more noticeable. Some of the most common symptoms of lung cancer include persistent cough. A cough that doesn't stop or gets worse over time is one of the most common symptoms of lung cancer. This cough may be dry or produce phlegm and often gets worse as the disease progresses. Chest pain. Lung cancer can cause chest pain, especially when you cough, laugh, or breathe deeply. This pain may be due to the tumor pressing on nearby structures or fluid in the chest cavity. Fatigue. People with lung cancer often feel extremely tired and weak, which may be due to the body's response to the cancer, anemia, or side effects of treatment. Weight loss. Unintentional weight loss is a common symptom of advanced lung cancer. Changes in metabolism can cause weight loss and muscle loss as the body fights the disease. Dyspnea. Shortness of breath or wheezing may occur when a tumor grows and blocks the airways, or when fluid builds up around the lungs and presses on lung tissue. Hemoptysis. Coughing up blood or rust-colored phlegm is a more worrisome symptom that often indicates that the cancer has invaded the airways. Hoarseness. Voice changes or hoarseness may occur if the tumor affects the nerves that control the vocal cords. Early detection of lung cancer significantly improves the chances of successful treatment and survival. Several diagnostic procedures are used to identify and stage lung cancer. Chest X-ray. Often the first test done when lung cancer is suspected. It can show masses or abnormal areas in the lungs, but is not as detailed as other imaging methods. CT scans provides more detailed images of the lungs and surrounding tissues. CT scans can detect smaller nodules that may not be visible on X-rays. PET scan helps determine if a suspicious area is cancer and check for metastasis. It involves injecting a small amount of radioactive sugar into the body, which cancer cells absorb more than normal cells, making them visible on the scan. Bronchoscopy. A procedure in which a thin, flexible tube is inserted through the mouth or nose into the lungs to collect a tissue sample. Needle biopsy. A needle is inserted into the chest wall to collect tissue from the lungs or surrounding lymph nodes. This is usually guided by CT imaging. Surgical biopsy. In some cases, more invasive surgery, such as thoracoscopy or thoracotomy, may be needed to obtain a larger tissue sample. Genetic and molecular testing of tumor tissue is increasingly important in lung cancer diagnosis. These tests can identify specific gene mutations such as ALK, ROS1 and can guide treatment decisions, especially targeted therapies. The above content only represents my personal opinion and is for reference only. Thank you very much for watching and listening.